Welcome Internet. Today we're going to be talking about how to handle the false self in psychotherapy. So in this video I'll be talking about how to fundamentally help people who have a false self from the point of view and the perspective of a psychotherapist. Meaning it's not going to be about how, as a patient, to help oneself. It's more about how the professional can get the help the patient needs. And so basically, therefore, it's going to be more focused on the clinician's perspective, i.e. the mental health professional, rather than on the patient per se. However, if you're a layperson that's interested in this question, be my guest and feel free to watch this whole video, right? There's no exclusionary process going on here. It's just my perspective and what I want to share today. Anyway, what do I mean by false self? Let's start there. The false self is a concept that was developed by Winnicott, in which he basically summarizes a very important phenomenon. In the first years of life, the infant, the baby, needs to be in an environment that adapts to him and their needs. And that basically that adaptation is going to fundamentally help them create an adjusted and healthy personality. Of course, and this is what's going to interest us today, is the environments that were not willing or capable of giving that basic sense of security and that basis for a quote-unquote healthy personality. Now, you might be directly sinking into traumatic events, which absolutely do play a role in the constitution of the false self. But it's not only trauma or neglect. Sometimes the tragedies of life, like losing a partner, losing a job, losing something that's fundamentally essential for one's development as a parent or another child, and so on and so forth, breaks down the parent. And what happens is the parent that's broken down cannot always adapt to the needs of the infant. Therefore, what is going to happen is that the infant, regardless of necessarily if there is abuse or not, but it's the idea that the parent is unavailable, is going to then basically adapt themselves too early to the parent. And this adaptation is going to create a sort of second strata of personality. So the first personality, the true self, is there virtually from the get-go. And in a good enough environment, a la Winnicott, meaning not an environment that allows for everything, but an environment that leaves the child to experience things and be able to voice their concerns or disagreements, it creates a good enough state in which their true self, so the first stratum of personality, can develop. And only later on, when the child is ready, can they develop a false self, but it's more adaptive. It's more about the social codes, the rules of society, and so on and so forth, rather than something deeply ingrained. So that's when it happens well. When it happens badly, the child is going to adapt that second stratum, the false self, as a way of defending the true self. Meaning, instead of imploding, these desires don't go away, this true self doesn't go away. It just gets hidden by a false self that adapts and super adapts to the environment. And so, with time and development, the true self is going to be relegated to a state of loss, meaning the person is going to not be in contact with it anymore. And this is going to create numerous types of issues, ranging from anxiety to depression, personality disorders, and so on and so forth. Because what you have to understand is that Winnicott's idea is not relegated to a psychopathological condition, i.e. mental illness. It's what is called transnosographic, meaning it's in a plethora of different conditions. And that's why it's so important to pinpoint. So the first thing on handling the false self is being able to recognize it. At least that's my belief, that you need to know what you're looking for. And often the therapist can see it by the fact that they will be dealing with a patient that is highly adapted to the therapist, that often tries to not invert, because there's no perversity involved, but to try and fulfill the needs of the therapist. They will try and adapt to the therapist, like going on schedules that are not necessarily good for them but better for the therapist. They might, how can I say, pay missed sessions even though they cancelled way in advance. There can be a plethora of adaptations, but the idea is that they adapt a part of themselves to the therapist. And also during the sessions, the therapist might have this odd feeling that something is not quite accurate, that the patient will be talking right, they will be sharing what they believe, what they feel, but something is not going to, how can I say, mark the point, or something's going to slightly miss the point, as if there was something that was in inadequation between what the patient is saying and what the therapist is feeling. That the therapist is feeling a bit at a loss or uncertain because there's something that doesn't seem quite right, but they can't pinpoint what it is. Also, there's often, at least in the people I have met with this type of defense mechanism, they often tend to have succeeded very well socially, that they are completely adapted, that they completely understanding of the rules of society and how things are supposed to work. So it gives this strange impression that they are themselves highly adapted, but it's only an adaptation at the surface level, because what they can say is, I don't know myself, I feel lost, I have the impression of playing a role, and so on and so forth. So there's a lot of things that contrast, like they might have the perfect life on paper, but they themselves don't feel connected to that perfect life. That can be an element to see through that. There can also be other forms of adaptations, like for example, a tentative to try and push people away when they come too close, because there's this fear that they won't be able to adapt beyond a certain point to these people. So the false self, once you have this hypothesis, and I'm going to be very clear, it can only ever be a hypothesis, right? But once you have the hypothesis, how do we work with people with false selves? Well, it's my belief that it's a very, very subtle and refined work. That at no moment can we barge in and break down the false self to get to the true self. This, I think, is catastrophic. There are very few instances I've heard of therapists trying to let's say, crowbar out the false self to get to the true self. The only experience I've heard about people trying to do that has led to catastrophic results. Because what you have to understand is that the false self was there to protect, to save the infant at a point where the true self was too fragile. And as such, the false self is as much a prison as it is a shield. Therefore, if you rip a shield from someone that's too vulnerable, they're not going to be able to defend themselves anymore, which might lead to breakdown or even suicidality. So it's my core belief that you have to be very, very patient and gentle with the false self. It's not about railroading your way through it, like ramming your way through it. Absolutely not. It's very slow, very delicate. So how does it work when working with the false self? Well, it's also my belief that there might be degrees, as Winnicott pointed out. And I'm not going to go back to ego distortions in terms of true and false self, which is the essay he wrote about this, which is very good. But I'm going to list out a couple of examples that I have seen clinically. There is, at the let's say the less severe level of the false self, there might be a more depressive element. Like patients might come with a certain form of mental suffering, that they're sad, they're depressed, they don't understand why. And often when you dig with them, what happens is they've felt that something was not right within their lives. Often when you go in detail with them, they always feel that they had to make an effort for someone else, that they could never be themselves. And that degree of false self for me is when basically, if we were to use a metaphor, it's like as if the true self was knocking on the door, but the false self was still too afraid to open the door. And these cases are, I would say, not necessarily the easiest per se, but they're not necessarily the ones that are the longest. Because what has to happen in those cases is slowly and gently open the door with the patient. To acknowledge the patient was defensive about certain elements of their lives, to showed them that basically they were masking certain elements of their being. And often because the true self is so very close to coming out of that state of ejection into the unconscious, because it's on the surface, patients can often identify it as being there. They can start to think and perceive it and start to unveil it slowly but surely. And often they only need a little bit of support of the therapist. And the therapist also has to acknowledge the vision between both instances, between the true self and the false self, for them to be able to integrate the idea and then slowly be able to reunite both of them. Because also I think one of the perhaps the cliches is that the aim is to destroy the false self. It's never to destroy the false self. It's to allow the true self to express. But sometimes, and people need to have a false self. It's important. Just for society's sake, right? So it's important to be able to use it. But it's important for it, the false self, not to crush the true self, not to destroy the true self. So in the cases of when it's on the verge of happening, the therapist might just need to be very gentle, tactfully reunite both of them with the patient. And the patient, through the dreams, through their lives, through the experience, through the trust and transference that they have towards the therapist, will be able to get back to their true selves. Because what is happening is that the therapist is being an environment that is adapting to them, what secretly they had needed all their lives but didn't get. And often that readaptation re-sparkles or re-triggers feelings and emotions from a very lost time ago. For example, feelings of, oh, I wish my mother was like this, or oh, I remember the one time my mother or father adapted, or what I was hoping when I was an infant for them to do, or when I was a child, when I was hoping deeply. So all these memories, all these expectations that were relegated to the unconscious mind and to the true self and its true needs basically were cut off. But with the help of the therapist, they basically coming back, and they're coming back in a gentle, progressive way. And of course, it's always about working out that progressive and gentle way, right? So even when it's there, you shouldn't basically break it out and try and assemble it in a speedy fashion. Nothing about the false self is involved with speed. So this is when it's like the false self is still strong, but the true self is, let's say, it's there, it's on the surface level. Now, what happens when it's in a deep or intermediary level? Well, on this level, the clinician might perceive that there is a false self, but the patient is unaware of it, or even worse, they feel that it's not quite accurate, that they have had good parents, or that the environment was nice and there's nothing to really talk about and on that level. And often the patient is going to be very reluctant to basically criticize their caregivers. What can be very important during those phases is to share with the patient this idea of imagos, i.e. internal pictures, to explain to them that we're not going to criticize the real parents, the true parents, the parents that for a lot of them they still have, but we're going to criticize the internal images that might not be exactly the parents, but might be how the child, the infant, conceives of them in their minds. This often opens a door to a conversation on what went wrong, because when the patient understands that it isn't this cliche that we therapists are not out for the blood of their parents, that they can start to think, oh, okay, I understand. And through this, they're going to be able, and this is going to be very important for that level of false self, to be able to express aggression towards their parents, towards what should have been there but wasn't. And when I mean their parents, I mean the imagos of the parents, of the expectations of the parent that they held but were not able to basically fight against, that they had to conform to what the idea of the parent wanted. Therefore, it is important to, how can I say, foster this aggression, because this aggression is is what is going to help the true self be able to come back to the surface. Because what you have to understand with the false self is that there's a system that prevents aggression from forming. Because if you need to adapt to another, you need to basically push out the aggressive elements of the personality, or to push them down, right? And here, when I mean push them down, I'm not talking about passive aggressive, right? I'm really talking about it's as if that it didn't happen, or if they were compliant beyond any reasonable level, or even excusing, yeah, okay, he did that to me, but he had his reasons, and so on and so forth. And the aggression here is a way of freedom. It's a way for the true self to be able to say, I have needs, and I am unhappy with my behavior, but also with how other people treat me. So that aggression is basically liberating. It's a form of freedom that cannot be there if the patient is terrorized by their internal images. And worse, and even worse, they might be terrified by the internal images and by their true parents, meaning that they're not there yet to try and fend against both. Therefore, decorrelating the internal images from the true parents can be a good solution to start this process of aggressivity. And then, when the patient is ready, moving on to the real people that are the parents. But it's not necessarily that constructive, because as I was saying, sometimes it's just the tragedies of life. If, let's say, a mother has lost another child, like an elder son, well, she's not going to be able to take care of the youngest because she's too absorbed in her depression. It's what Green calls the syndrome de la mère morte, i.e. the dead mother syndrome, right? And this is going to cause a lot of suffering. So it's not necessarily about attacking the real parents if there's, let's say, if it's a tragedy of life. Or if they are to be attacked, it's not necessarily breaking ties with a parent, not necessarily. But this aggression needs to be made manifest, and that's what I'm trying to transmit. It's very important. And then when the aggression is made manifest, then there can be a true sadness for that real self, that true self that was oppressed and repressed all these years. And this is a very good perspective, because that means the patient is rekindling with their needs, with who they are and with who they can be, meaning that they can then start to live their lives for who they are. And the third level I wanted to talk about today is a level that I have encountered just a few times, but I still think it's important to talk about. There's some cases where you might, as a therapist, feel that the patient has a false self, but there's nothing beyond that. What I'm trying to say is that the true self is so fragile or even inexistent that if you were to take out the false self, then just the personality would completely collapse. And not that therapeutic collapse of it collapses and then we rebuild. No, it's a complete and utter collapse. And this is often the case, not always, but often the case in psychosis or schizophrenic, as we would say in psychiatry. Perspectives that, for example, the psychotic elements are kept at bay by the false self. The false self is the last level of adaptation, and it's the one, if it breaks down, everything breaks with it. And in this moment, it's going to be very important for the clinician to basically weigh if it's good or better for the person to deconstruct the false self, or if it's better to be left in place. So this is going to be very controversial, because most therapists believe that the false self needs to go regardless. But in these specific cases, I think that it really needs to be reflected upon if it's worth it. Because, as you might know, once there is psychosis and it's in a chronic state, we don't know how to come back to a pre-psychotic state when it's not short-term, right? So it really needs to be thought about. And I don't have a clear answer of yes or no. I'm just saying that it really needs to be very, very, very delicate. I was saying delicate beforehand because I do believe that, but this really needs almost like a microscopic delicacy, right? Because if you feel that there's something that's schizophrenic or psychotic behind the false self, it really, really needs a lot of, like, how can I say, prudence to be able to be handled. Because if you go too far, if you're too brutal, then the whole structure of personality could collapse. And that would give the individual immense suffering. And sometimes a false self, and in these cases, one can question it like that, can be a safeguard. And I mean that in the truest sense. Therefore, it has to be really something that has to be thought about, both from clinician and from patient. And sometimes it might be worthwhile not going that far or not going that way. Of course, this is only my perspective. And the last part I wanted to talk about, and this will be more the side note, that some patients can come into therapy saying that they have completely deconstructed their false selves alone. This often, in my experience, shows that it's often people with severe character or severe personality organizations that feel that they have gone beyond what the normal patient, and they often want to impress the therapist, both by having technical vocabulary and by doing something that is considered hard. But what you should know as a therapist is that deconstructing the false self is incredibly subtle, nuanced, and takes years. And as my supervisor once told me, and I'm going to use her perspective here because I find it very, very helpful, that it's a bit like an onion. The false self has many layers. And the aim is not to get rid of every single layer of the onion, but a few. You take it out, until the patient can have a true self that can shine a bit without being completely naked or defenseless. And I found that to be a completely great analogy, so therefore I'm sharing it with you, right? And people that come in and say, I have solved that problem completely, often are all misguided or trying to misguide the therapist. So I wanted to finish on this note because it does happen a bit, and often it doesn't mean that these people are advanced, or at least the people I have seen who have been very, very self-confident about it, in my experience, haven't been those who have really deconstructed it. Quite the opposite. Those who have maintained their false self at any cost. Anyway, I hope you enjoyed this video. Of course, and I need to say this is not like exact, precise science. This is only the perspective of one French clinical psychologist, so feel free to disagree or to basically challenge my positions. I have nothing against that. Anyway, I hope you liked this video. If you want to ask any questions or anything you want to add, feel free to do so in the comments. I'll see you next one. Bye.